class back now. Good morning. My name is Francesca. I'm going to be one of your nurses today. Can you verify your full name and your birth date for me, please?
Yes, my name is Madeline Marcus and my birthday is 6/10/1998.
Okay, perfect. That's what it says on your wristband. Do you know why you're here right now?
I'm at Embryo Hospital and I'm here for surgery.
Okay, perfect. You'll be going into the OR shortly, so I'm here to do your pre-op assessment. I have a series of questions to go over with you. Would that be okay?
Yes, of course, go ahead.
Okay, perfect. Let's start with your vitals first. Vitals look great. On a scale of 0 to 10, what is your pain level?
I'm about a 2 right now.
Okay, sounds good. I want to make sure that we have all the necessary paperwork on file that we need. Looks like we're all set. We have your H&P, your advance directive, your power of attorney, and your signed consent. I've also reviewed your pre-op labs. Can you tell me in your own words what procedure you'll be having done today?
Yes, they are taking out a part of my colon, the left side.
Okay, yep, that's perfect. That is what it says on your file today. Do you take any medications, including any over-the-counter drugs like aspirin or Tylenol, or any herbs or diet supplements?
I do not know.
Do you have history of substance abuse like alcohol, tobacco, marijuana, cocaine, or amphetamines?
No, why are you asking me that?
Any substance use can influence the amount of anesthesia you'll need during surgery, so it's really important that we have this information before you go in.
Oh, well, I do smoke weed sometimes. The last time was 3 nights ago, I believe.
Thank you for your honesty. I'll note that for your surgical team. Do you have any allergies?
I do. I'm allergic to sulfa drugs.
Okay, and what happens when you take those?
I break out into hives.
Okay, good to know. What about any history of allergic reaction to latex, animals, or pollen?
No allergies at all to latex or other things.
Okay, thank you. Do you currently have any rashes or open wounds?
I have a little wound on my right leg, but I think it's healing.
Okay, let me take a look here. Okay, I will note that in your chart then. When was the last time you had anything to eat or drink?
They said I couldn't eat anything after midnight, so I haven't had anything since dinner around 6 p.m. last night.
That's perfectly fine. Have you had any surgery in the past?
No, this is actually my first surgery.
So you've never had anesthesia before?
No, I haven't.
Do you happen to know if you have any family members who have had a reaction to anesthesia in the past?
I asked my mom about this, and she said that we do not have any known issues with anesthesia in our family.
Okay, that's great. Do you have any other conditions, like any heart, kidney, or liver conditions?
No.
What about any respiratory issues, like asthma or even a recent flu?
No. Wait, I do have diabetes. Is this something you need to know about?
Yes, actually. Do you take anything for that?
I do normally take insulin, but the doctor said to skip it this morning, so I did.
Okay. And when was your last menstrual period?
About 6 weeks ago.
Are you on birth control?
I am taking birth controls. Actually, the doctor asked me to stop taking it 2 weeks ago, so I did.
Okay. Do you have any leg pain right now? Is there any tenderness or swelling in your calves?
No, I don't think so. I think I'm okay.
Okay. And then when was the last time you used the bathroom?
I went right before entering this room, actually.
Okay, sounds good. Do you have any general questions about today's procedure?
I don't think so, no. I'm more anxious about the surgery, if anything.
That's understandable. It's normal to have some anxiety before surgery. The good thing is you won't be alone. The whole team will be here and you'll be under close monitoring. During your surgery, you'll be under general anesthesia. This means you'll be asleep and won't be aware of what's going on, okay?
Okay, that doesn't sound too bad.
Okay. After you wake up, we'll help you with your pain management and medication to keep you as comfortable as possible during your recovery period. Also, you can expect to see a catheter when you wake up so we can monitor your urine output. It is important that you stay consistent with mobility, deep breathing exercises, and that you cough after your surgery. This helps with a few things. It will help blow off the anesthesia from your system, and it helps prevent your lungs from collapsing and pneumonia. They'll show you a device called an incentive spirometer that can help you with that. Be aware of any signs of infection, any redness that's spreading, warmth, swelling, or around the surgical incision. If you notice a fever or any new signs such as new chest pain, nausea, or vomiting, please contact your doctor. And lastly, they'll put on sequential compression devices on your legs, and this just helps prevent any blood clots from occurring. Do you have any other questions?
No, I think you covered it all. Thank you.
Okay, not a problem. I'll put a call into transport and get you ready for the OR, okay? Patient here ready for the OR. She is a 26-year-old female, Madeline Marcus. Her birth date is 6/10/1998. Her BMI is 35. She's scheduled for a left hemicolectomy, and this procedure will be completed with Dr. Mendez, and the anesthesiologist is Dr. Johnson. She has an allergy to sulfa drugs. Patient is NPO since last night, 1800. No prior surgery, so she's never had general anesthesia before, but has no family history of any complications with anesthesia. She is a type 2 diabetic and was asked by the doctor to skip her insulin dose this morning. She reports use of marijuana occasionally. Last use was about 3 days ago. Patient also reports use of oral contraceptive pills, but stopped 2 weeks ago per request of the doctor. She is experiencing some anxiety about the surgery and rated her pain at 2 out of 10. She has an IV in her right forearm. Baseline vitals are stable. She has hypoactive bowel sounds. She has a superficial wound on her left leg. Pre-op labs were reviewed, and they are all within normal limits with the exception of glucose, and that's mildly elevated at 132. I'm recommending a close monitoring of her blood glucose due to her diabetes, as well as SCDs to help prevent VTE due to patient's high BMI and oral contraceptive use. Other than that, I've called into transport, and patient should be arriving within the next 20 minutes or so.
All right, sounds good.
Okay, thank you.
Hi Madeline, my name is Krista, and I'm the nurse that will be taking care of you during your surgery today. Before we get started, I need to ask you some questions. First, can you verify your name and date of birth for me?
My name is Madeline Marcus, and my birthday is June 10, 1998.
Thank you, Madeline. And can you tell me what surgery you're having today?
They're removing the left side of my colon?
That is correct. Lastly, do you have any allergies?
Yes, to sulfa drugs.
Great. I can see that that is documented in your chart, and the surgical team is aware.
I'm feeling nervous about my procedure. Are you going to be there with me the whole time I'm in surgery?
That is completely understandable. And yes, I will be there with you the whole time, and you can ask me as many questions as you would like.
Thank you.
And we're going to perform what is called a surgical timeout. Everyone in this room is going to confirm your identity, the procedure you're getting, and the correct surgical site, and make sure your information matches before we begin. It may sound repetitive, but safety checks like this ensure that you receive the best care possible. This is Madeline Marcus, a 26-year-old female born June 10th, 1998. She's scheduled for an open left hemicolectomy with Dr. Mendez. Consent has been signed and verified. Left hemicolectomy is confirmed. The patient has an allergy to sulfa drugs, and we administered the pre-surgery antibiotics. Does everybody agree?
Yes. Agree.
Everyone agrees. Okay, Madeline, now that the timeout is over, I'm going to make some adjustments on you to make sure your body is comfortable during your procedure. I am going to apply these compression sleeves over your legs. This will help prevent the form of blood clots.
All right, we are going to start administering anesthesia now.
Wait! I'm nervous about this. How do I know I'll wake up?
Madeline, it is completely understandable that you might be anxious. We will be with you the whole time, and you see all these monitors? This is so we can continuously watch you and make sure that you are safe throughout your surgery.
Okay, here goes nothing then.
Now that the patient is asleep, we will begin to position her. The patient is currently in a supine position, and I'm making sure that her arms are padded as well as any other bony prominences. That way we can avoid the development of pressure injuries. We are now inserting a Foley catheter, and we are making sure to use sterile technique to avoid infections. I am now applying a bear hugger and a warming blanket to the patient. Okay, I am now assessing the site of the surgery to make sure that the skin is intact. And I drape the patient. Next, we will count the number of sponges and instruments we are going to be using during the procedure. The procedure has been started. Currently, I am documenting the patient's bolus, urine output, specimen collection, and maintaining a sterile environment. We're also going to check our patient's glucose level. The patient's vital signs have remained stable throughout the procedure. The procedure is complete. We have counted the sponges and the surgical instruments used during the procedure, and it lines up with how many we started with. I can see that the patient's dressing is clean, dry, and intact. The patient will now be going to the PACU. Hi Laura, I have Madeline Marcus here. The patient's date of birth is June 10th, 1998. She just had an open left hemicolectomy with Dr. Mendez. The procedure was completed without complications under general anesthesia. The patient is currently stable and being transferred to the PACU. The patient has a past medical history of type 2 diabetes and has a BMI of 35. She is allergic to sulfa drugs. The patient has been NPO since 1800 yesterday, and she skipped her morning insulin dose as instructed.
Okay.
During surgery, we applied compression devices on her legs that stayed on during the procedure. We also inserted a Foley, and the patient is currently voiding clear yellow urine. Final sponge and instrument counts were done and correct. The surgical dressing is clean, dry, and intact. The patient received antibiotics before the procedure to prevent infection, and has just received pain medication and antiemetics from anesthesia to help control pain and nausea. Vitals remained stable during surgery, but her last glucose was 135. I recommend continued monitoring of her airway, pain, blood glucose, urine output, and incision site.
Okay, sounds good. Thank you.
Knock, knock. Hi, my name is Laura, and I will be your nurse until we get you transferred to the medical surgical unit. Can you verify your name and your date of birth for me?
June 10th, 1998. My name is Madeline Marcus.
Okay, correct. And I'm just gonna
Put some hand hygiene.
do you know where you are right now, Madeline?
Yes, I'm at Ambria Hospital.
Yes, and then do you know what year it is?
Yes, it's 2026.
And now can you rate your pain from 0 being no pain at all to 10 being the worst pain?
I'd say it's a 5.
Okay, looks like the doctor ordered you IV hydromorphine as a pain medication. I can give that to you now if you like.
Oh, please.
All right, so Madeline, your surgery went well. There was no complications. You do have a left JP drain and an adjoining catheter placed. The JP drain is temporary and it will help drain excess fluid and blood from that site from surgery. We do have to make sure that you don't pull on it, so be very careful with it. I have pinned it to your gown so it can drain properly and to prevent it from being tugged on. I will show you here. So it is on this side here, and it is currently on your gown. And then you do have a catheter that will help drain urine until you get more independent and you're able to urinate on your own. It usually is removed on the second day post-op, but we will see what the doctor orders. This is also something that we have to be careful when moving around. Before moving on, can I take a quick listen to your lungs?
Yes.
Okay, everything sounds normal. Now I will do a set of vitals, assess your belly, the site, and also check your blood sugar. Your wound dressing is here on the left side. It is dry and intact. And then I'll do a blood sugar. Vitals are stable. And your blood sugar right now is 128. Your provider did order a clear liquid diet, so you can order apple juice, water, ice chips. Is there anything you like that I can get you right now?
Just some ice chips, please.
Okay, yes, I can get you some ice chips. Once we notice that you're tolerating your diet, we can advance to full liquids and then eventually soft foods. I'm going to connect the SCDs now, and this will help prevent blood clots. So I'm connecting the SCD machine to the SCDs, and that's on. The doctor does want you up and moving at least 3 to 4 walks today around the unit. One of the staff will help you when you get to the other unit. Walking is important to prevent complications like DVT and pneumonia. Are there any questions you have right now?
No, I think I'm okay. Just sleepy.
Yes, that is normal. The anesthesia should be wearing off soon. I'm going to call the other unit to see if they have your room ready. If you have any questions, please use your call button. Because you just had surgery, you are considered a fall risk. So do not get up without asking for help. I will be right back. Thank you. All right, Madeline, so I called the other unit and they are ready for you. So we're gonna be getting transferred up to the 4th floor. Okay. Hello. Hi, so I have here patient Madeline Marcus, a 26-year-old female that will be transferring to your med-surg floor in room 4025. Madeline had a left open hemicolonectomy that was performed by Dr. Mendez. She arrived to the PECU floor at 13:30. She is in stable condition. Surgery went well and is ready to be transferred to your floor. And she did have general anesthesia with no complications. A blood loss of 160 ml was reported. Patient reports allergies to sulfa medication. medications. Reports occasionally smokes weed. Last time was 3 days ago. She does have type 2 diabetes, so she will be in AccuCheck. Her blood sugar was checked prior to surgery and it was 132. During surgery, it was 135, and I checked her sugar now before arriving to the floor, and it is 128 now. I did not give insulin as it did not meet the sliding scale. She does have a wound on the right leg that was prior to surgery. This is not surgery related, but I'll show you here, and it's healing quite well. I did put a bandage on it. She has an incision on the left side where her surgery was, and she also has a JP drain and an indwelling catheter. Madeline is alert ×4. Current vitals are 116/72. Heart rate is 68. Oxygen is 99 on room air. An oral temp of 37.2. The doctor did order IV hydromorphine, 1 milligram for pain every 6 hours. I did give a dose, and that was at 1345 for pain. That was reported 5 out of 10. And then after giving the medication, it was 2 out of 10. Her abdominal dressing is clean, dry, and intact. She does have SCDs on. Catheter is draining on the side over there by you. I did empty 200 ml at 1410, and urine is yellow and clear. The JP drain, I did empty 30 mLs, so that's emptied right now. Drainage was serosanguous. Patient has an IV in the right forearm, right here, and that is running with lactated ringer at 100 mLs an hour. The doctor did order clear liquids that can be started. She only asked for ice chips for now. She has not yet ambulated, so doctor did order at least 3 to 4 walks. And the diet can be advanced as tolerated. No orders yet on when Foley can be removed.
All right, sounds good.
All right, Madeline, it was a pleasure taking care of you, and I hope your recovery goes well. Here's your call button. Thank you.